so, and I think I've said all this, that not only you can't work as efficiently, but also those who worked in isolation often mentioned feeling ill at ease about the quality of care that they were providing, and going home and feeling like they really had to call a ward because they were just afraid that they left something undone. So that's one study. That's the nurses' study. Even though the next one is it's in healthcare, but it's in community-based healthcare, I think it's worth looking at because it's, again, a story of teamwork. It's a study of counselors in women's shelters that we were asked to do by the group, the Confederation of Women's Shelters in Quebec, who asked us to do this study because of enormous rates of psychological distress among the counselors. And this was at a time, again, when funds had been severely cut to the Women's Center, which actually is no longer the case quite so much. Partly, in fact, because they used our study effectively to get more money. And we did, again, about 100 hours of observations, interviews, and so forth, the same method as before. And the cause of the distress, again, just like nurses and other healthcare workers, most important cause of distress was the feeling that the workers couldn't do their job properly. And one of the major causes, and the one that we decided to concentrate on, was the feeling that they were constantly interrupted. And when you're in a milieu de vie, a shelter, which is a 24-hour-a-day, 7-day-a-week organization, everything, and particularly a feminist organization with the ideology of empowerment and constant reinforcement of women's own power to influence their lives. The counseling that they did was not just sitting down in a closed room with people, but also in everything that they did, it was thought of as counseling. Preparing dinner in a group with the people, with the clients of the shelter, was considered to be counseling. So they were doing this very intense job, and they were constantly being interrupted. And even during one-on-one counseling, which could get very hairy, I mean, it could, you have people who've been beaten and who are feeling threatened and who are going to court the next day, but you're constantly interrupted. They never had time. Shift-to-shift continuity was a big issue in this shelter, but they didn't have time to take proper notes or to read the notes on the day before. And they didn't have time to share knowledge about people because you may be one-to-one on this person today, but your colleague prepared supper with her last night and knows some stuff that you may not know. And the other thing that we found interesting, and I've seen this in other places, is the only people who got to take breaks were the smokers. Smoking is a really important factor, positive health factor for people in healthcare. Because it's true in so many jobs and in community organizations particularly, that the only people who take breaks are smokers. I'm all for smoking. At the beginning, because they didn't have enough money, there wasn't enough money to have more than one person at a time often, particularly in the evenings and nights. But new money came in, and it went to more staff, which was a nice thing and a good thing. But when we studied how interruptions happened, what we found was that although and we did a kind of an examination of who interrupted, when did they interrupt, during what activities, and so forth. And what we found was the interruptions were much more frequent after they got more staff. Well, it makes sense. You can, if you've got more often two counselors working together, they're going to interrupt each other more often than if they're alone. And when the counselor was alone, the clients interrupted her. But when the counselors were in pair, the other counselor always interrupted constantly. And so we looked at why they interrupted. A lot of it had with the informal nature of counseling in feminist intervention, because feminist intervention is not a course you took at university. So people are constantly improvising methods, and therefore they need to validate what they're doing. But in any really compelling job like that, you really do need this constant support, and it's true in other areas of healthcare. And so we needed to set up some ways to reduce the amount of interruptions. And I'm not going to go into the details of all of these. Some of them had to do with the software that they used to take their notes. Some of them had to do with the kinds of scheduling that was done. But what I am trying to say is that you really have to think about teamwork and support it actively within an organization. You can't just say, you know, it's nice that there's teams. You have to think of methods that are going to actively promote and nourish teamwork, which is not what's happening in the healthcare system now. Another study of teamwork that we did deals with discrimination, gender discrimination, which is one of my interests in life. And this is a study we did a few years ago on sharing of physically demanding tasks. Even though this meeting is about mental health, I think it's worthwhile thinking about teamwork in terms of sharing physical tasks for a number of reasons that you will see. What we did first was, I'm going to call them healthcare aides. It's préposés aux bénéficiaires in Quebec, and there's, I think you called them, they've been called 4 different names here this morning. Personal care assistants, perhaps. So PCAs, I'll try that one, and if I remember. And what happened with these jobs was that it used to be called PCA light work and PCA heavy work. And men did the heavy work and women did the light work. And of course they were at one time paid differently. Then they got pay equity, thanks to Pat, and who was in Quebec at that time. And then the jobs were merged, and there is no longer a separate male and female designation. And when I was doing training, ergonomics training for this population, for the CSN union, we heard from the people from the PCAs in the sessions that they didn't like the fact that the jobs had been merged. That they said it was unfair to men were overworked, nurses always asked men for help and they never asked women. So with this in mind, we thought, well, we'd go in and we look and see how the physical aspects of the task could be made easier for women so that women could contribute fully and be more appreciated. So the first thing we did was get a list of what were called physically demanding tasks from the PCAs, and we asked them to rate these tasks. And then we looked at these tasks alone and we said, who's doing them, and when are they being shared, and when are they being done alone? So one of the things that we noticed was in the morning shift, nobody could share the tasks. 86% of tasks were done, physically demanding tasks were done alone on the morning shift, whereas only 39% were done alone on the afternoon shift. So that was one thing that we found. Another thing we found that had direct implications for the hospitals was that you always had one aide per patient, but it would be logical to have one aide doing if there's 2 patients in a room, assigning the 2 patients to the same aide. But in fact, that is not a good idea, because when you had 2 aides assigned to the 2 patients in their rooms, then they were able to share more of the physically demanding tasks in the job. And that was actually a suggestion that I think even made it past the first year after we made our recommendations, because it was an easy change to make. But of course, what interested us was the question of gender, and so our first surprise was that we're doing 61.2% of their actions alone, and men were doing less of their actions alone. And then in terms of physically demanding tasks per hour, the women were actually doing 1.5 times more than the men. So that was a bit of a result about what, if you're thinking about teamwork, you have to think about intergender relations. And the other, and that I said. And the other was this question that we'd heard, nurses always ask the men to help. It's not fair to the men that they're always being asked for this. So we also, in our 101 hours, or 61 hours of counting the numbers of helping actions, we looked at how often the nurses asked for help and who did they ask. And guess what? Women aides help nurses almost 5 times more often if you do the math on this one. That women help a nurse more often than they are helped by a nurse, whereas males help a nurse much less often than they are helped by a nurse. This is based on who initiated the collaboration. So when we are thinking about teamwork and how teamwork should be handled, we have to think about issues like gender discrimination, racial relations, gender relations. A little word, I think we could just resume it all and say power relations within the team as well. Power and hierarchy, both formal and informal, if we want to nourish and help develop teamwork. Dealing with the results of this was not evident, and I just want to point out to you how difficult it is to set up dialogue in workplaces around issues of intergender collaboration and ethnicity collaboration. These are taboo subjects. They are very hard to bring up. They are very close to people's feelings, and so we have not found a good way to do it. The union took these results and made a brochure about intergender collaboration in a number of settings, because this was not the only setting where we did the study. And the brochure was essentially rejected by the health and safety people. So this is an ongoing thing, but I did want to bring up the centrality of intergender relations in developing teamwork. And finally, because it's recent, how long do I have?
You've got as much time as you, don't worry.
Okay. Because this study is just out. It's submitted. It was done last fall by Lydia Abbas and myself. It was done in a semi-private hospital, which had a huge problem recruiting staff, and this seems to be a pretty general problem in a lot of these hospitals. It had 245 patients and 277 care employees, but that's not because they were so well staffed, it's because they had so many casual people. 192, I call them nursing assistants. They're still the same old préposés aux bénéficiaires that we've been talking about, so the PCAs, I guess, of whom 99% were women, and they actually came out and said, this is totally illegal, but they came out and said that they only hired women for this job because the residents wouldn't stand for it if there was a man, because the residents were all women. And Lydia did 16 interviews with the nursing assistants or whatever, and 30 hours of observations. She didn't do as many hours of observations as we usually do, just because this was the exact same profession that we'd been observing for a long time. And we did, and this was quite a wake-up for me, 2 interviews with the managers who did the scheduling. This is a job I'd been wanting to observe for a long time. The poor person on the other end of the phone, when you call up and say, I can't come in this morning because my kid's sick. That is just such a horrible job. And we talked to these 2 women who did that for about an hour and a half each. One of the things that came out of this was when in the interviews, when we asked people what was the reason for their most recent absence from work,